In September, Norton Healthcare will receive the 2011 National Quality Healthcare Award from the National Quality Forum. Norton Healthcare President and CEO Stephen Williams explains the organization's commitment to quality and plans to raise the bar in the future.
Norton Healthcare's selection to receive the National Quality Healthcare Award is a tremendous honor, and every individual within the Norton Healthcare family can be rightfully proud. Our receiving this honor is recognition of the accomplishments of literally thousands of dedicated employees and physicians who have worked as a team to achieve remarkable results in quality and patient safety, and to establish an organizational culture of continuous quality improvement. To fully appreciate this award, one needs to understand that attaining it is the result of a 25-year journey. In fact, the award really should be attributed to the vision of Jim Petersdorf, former Executive Vice President and President of Norton Healthcare. In 1985, Jim made the decision to make continuous quality improvement a strategic focus for the entire organization. This came from his firm belief that we could learn much from leading organizations in other sectors of the economy, such as manufacturing companies like Hewlett-Packard, information systems like IBM, retail like LL Bean, and even fast food organizations like McDonald's. These organizations had implemented the teachings of total quality management and continuous quality improvement by quality gurus such as Edwards Deming, Joseph Juran, and Tom Peters. Those companies had attributed their sustained success by defining the requirements of their customers, using carefully trained tools to determine the most efficient process to get the best outcome in product or service, and then has initiated sustained organization-wide continuous efforts to take the variation out of processes, thus attaining the desired results each and every time with zero variation. The strong foundation for quality improvement that Jim Petersdorf laid back in the 80s has had much built upon it. What Norton Healthcare physicians, staff, and leaders have accomplished over the last 2 decades is indeed extraordinary. For example, fast forward to March 2005, when our organization astonished the healthcare industry by launching the online Norton Healthcare Quality Report, which displayed our results for 223 nationally recognized indicators for clinical quality and patient safety, including comparisons of our performance to state and national averages. With this action, Norton Healthcare committed to openly report all of our quality results, good and bad, without cherry-picking just the indicators on which we excelled. Since that time, the Norton Healthcare Quality Report has grown to more than 600 indicators, still far more than anyone else in the industry, for our hospitals, outpatient centers, physician offices, and urgent care centers. These indicators, which encompass clinical quality, patient safety, patient satisfaction, nursing care, physician office care, and cancer survival rates, have been vital tools in helping us identify opportunities for improvement, comparing ourselves to national benchmarks and best practices, and thus facilitating continuous improvement in everything we do. It is important to know a few key details about the NQF National Quality Healthcare Award. Norton Healthcare is the 18th recipient of the annual award and the first in Kentucky. If you'd like to know the company we're keeping, consider some of the previous recipients, including Intermountain Healthcare in Salt Lake City, Brigham and Women's Hospital in Boston, Baylor Healthcare System in Dallas, and Northwestern in Chicago. We are honored to be part of this very impressive group of leading healthcare organizations that are serving as role models for achieving meaningful, sustained quality improvement. With this award, we've joined a leadership group that is raising the tide for healthcare quality in our industry. And as the famous expression goes, a rising tide raises all boats. There is only one NQF recipient each year. Indeed, this represents one of our nation's most prestigious quality awards from an organization that exists solely to help raise the quality of American healthcare. And you can't be in a much better peer group than that. This philosophy from the Institute of Healthcare Improvement has guided our quality efforts over the past 25 years. Quality improvement is not a program or a project. It isn't the responsibility of one individual or even those assigned to the quality department. Meaningful and sustainable changes are possible only when people throughout an organization feel a shared desire to make processes and outcomes better every day. One of the fundamentals of quality management and continuous quality improvement is just that. It is continuous. It is not a destination, but rather it is a journey. As we pledge within our statement of values, we will continually improve, whether it be quality of clinical care, quality of services, our stewardship of resources, our scope of services provided, and on and on. While it is a great honor to have been recognized by NQF as this year's National Healthcare Quality Award recipient, we also must recommit to build upon the successes we have had and to continually strive to improve, day after day, year after year. That commitment to our mission, our vision, and our values is what has made Norton Healthcare worthy of this award, and likewise, that commitment is what will make us successful in the years and decades to come.
And for more information, visit nortonquality.com.